6 dangerous side effects of amlodipine you should never ignore. What if the medication trusted by more than 70 million people worldwide, the same little pill you or someone you love may take every morning, could be quietly setting off a chain reaction inside your body? A reaction that, if left unnoticed, could turn deadly before you even realize something's wrong. This isn't fear-mongering. This is about understanding the truth. In the next few minutes, I'm going to reveal 6 dangerous side effects of amlodipine that often slip under the radar until it's far too late. And here's the chilling part. Even just one of these side effects sends thousands of unsuspecting people to the emergency room every year. Sure, you've probably heard about swollen ankles or occasional dizziness, but this video is different. We're not talking about mild annoyances. We're talking about silent warning signs that scream medical emergency, if only you know how to listen. The information here goes beyond the standard patient leaflet. Every fact has been carefully verified from trusted medical sources. Still, remember, this video is for educational purposes only, and not a substitute for professional medical advice. Now, let's dive in. 1. BRASH syndrome. Most patients have never even heard of BRASH syndrome, yet it's one of the most catastrophic complications linked to amlodipine. BRASH stands for bradycardia, renal failure, AV node blockade, shock, and hyperkalemia. Sounds complex, right? Here's what it really means. Your kidneys start failing, potassium floods your blood, your heart rate plummets below safe levels, and your body spirals into a vicious cycle that can end in total collapse. Imagine your heart beating so slowly that it can't pump enough blood to your kidneys, which makes them fail even more, which drives potassium even higher. And the cycle spins faster and faster. Studies show nearly 6 out of every 100 people who develop BRASH syndrome don't survive. A third of patients end up needing devices to keep their heart beating. Elderly patients, especially those who are dehydrated or fighting infections, are at highest risk. Think about it. A simple blood pressure pill could push a fragile system over the edge in just days. 2. Gingival hyperplasia. This one sounds harmless, just swollen gums, right? But it's far more than a cosmetic issue. Amlodipine can cause your gum tissue to grow uncontrollably. It can make eating, speaking, and even smiling painful. Research shows it can happen in as little as 3 to 6 months, even at low doses. What's worse, men are over 3 times more likely to develop it than women. And sometimes even stopping the medication doesn't make it go away. Some patients end up needing surgery to remove the excess gum tissue. This isn't just about appearances, it's about quality of life. If you notice unusual gum changes, it's your body whispering a warning before it starts shouting. 3. Acute kidney injury. Amlodipine is supposed to protect your kidneys, but under certain conditions, it can do the opposite. If taken in overdose or mixed with other kidney-stressing drugs, your kidneys can suddenly stop filtering toxins. This is called acute kidney injury, and it can strike fast. Early warning signs, swelling in your legs, decreased urination, extreme fatigue, and mental confusion. These aren't symptoms you can afford to wait out. Severe cases require dialysis, and recovery can take months. In some patients, kidney function never fully returns to normal. 4. Stevens-Johnson syndrome, SJS. This is one of the rarest, but deadliest, drug reactions known to medicine. SJS begins like the flu, fever, sore throat, fatigue. But within hours to days, your skin starts to blister and peel away as if you've suffered a massive burn. Mortality rates range from 5% to 10%, and in the more severe form, toxic epidermal necrolysis, it can climb as high as 50%. Patients can lose so much skin that they need intensive care, fluid replacement, and infection control just to survive. If you ever develop sudden fever with painful skin, mouth sores, or blistering while on amlodipine, it's not just a rash. It's a life or death emergency. 5. Thrombocytopenia. Your blood relies on platelets to clot. Without them, even a small bruise or nosebleed can turn dangerous. Amlodipine can, in rare cases, cause platelet levels to crash to almost zero. Imagine waking up with purple spots on your skin, unexplained bruises, or bleeding that won't stop. This isn't bad luck. It's your immune system destroying your platelets in response to the drug. Severe cases need hospitalization, transfusions, and immune therapy. And because amlodipine stays in your body for days, recovery is slow and closely monitored. 6. Angioedema. This allergic reaction can swell your lips, tongue, and throat within minutes. It's unpredictable. Some patients have mild episodes at first, others face a full-blown airway emergency the very first time it happens. Think about it. You're sitting at home, taking your usual pill, and suddenly you can't breathe. Doctors have documented cases requiring emergency airway procedures just to keep patients alive. If you ever feel sudden swelling in your face or throat, treat it like your body's fire alarm. Get help immediately. Amlodipine saves lives every day, but it can also cause rare, dangerous, and sometimes fatal reactions. The key is awareness. Your body often warns you long before disaster strikes, but only if you know how to recognize the signs. I'm not telling you to stop your medication. That's a decision only you and your doctor can make. But I am telling you this: never ignore strange new symptoms. That little pill may be powerful, but so is knowledge. If you found this video helpful, please give it a like and share it with someone who might need to hear this. Staying informed could save a life, maybe even your own.